So first, I just want to give you a little background information about my lupus. At the age of diagnosis, I was about 17. I was having what is known to be typical symptoms now, but in the early 90s, a lot of doctors just could not put the pieces together. I had hair loss, weight loss, facial rash, extreme fatigue, anemia, joint pain, and muscle aches, to name a few things. I saw about 4 doctors before finally being diagnosed in 1998. After diagnosis, I've had brain swelling, minor strokes, blood clots, and weight gain, to name a few things. The last 16 years living with lupus has been a roller coaster ride. It's had its ups and downs and highs and lows, but participating in this trial has definitely been a bright star in my journey. I want to tell you why I'm participating in this trial. In clinical research, I'm doing this to benefit myself and the entire lupus community. I want to take back the power. I always tell myself and my friends that have lupus that we may have lupus, but lupus does not have us. My clinical trial participation started with the CIS-SLE Lupus Sister Research Trial. This is an example of an observational study since no drug was tested. My sister, who does not have lupus, and I would just have blood drawn so researchers could study the familial connections in lupus. Then, at the recommendation of my physician, Dr. Cynthia Arano, we took the next step and went into a study testing eprotuzumab as a potential new drug treatment for lupus. I've been in this trial for about 3 years now. I'm now currently in the open label portion, so I know that I'm definitely getting the drug, and I can pretty much say that it is really saving my life. Benefits of trial participation. For me, taking part in a trial has important physical and emotional benefits. Physically, I'm taking part in the Embody trial because my doctor and I felt it was the best treatment option for me at the time. I was not doing well, and there aren't a lot of drug treatments available for lupus patients besides the typical steroids, which have a lot of side effects, and other drugs that also have side effects. I know I'm getting excellent treatment with people who really care about how I'm doing, and it has made a major difference in how I feel physically and emotionally. Emotionally, taking part in a trial is very empowering. I feel like I have a sense of responsibility to the lupus community to do everything I can to help everyone dealing with this disease. My earlier years with lupus were not good, and I would hate anyone to have to go through what I did. I don't want to tell my age, but I mean, I've had lupus longer than there was a Lupus Research Institute, so you can imagine the early years were kind of rough. So if I can help others behind me not go through what I went through as a teenager, I'm going to do it. It helps me to help other people. It makes you feel you have lupus, but lupus it doesn't have you. You're taking back control over the disease. It makes me feel hopeful on a personal level because I'm helping to do something that could potentially save my own life, and helpful on a general level because I am participating in something that could save the lives of other people. I feel strongly that it is especially important for people of color to participate in trials because we are underrepresented in most trials, particularly in diseases like diabetes and lupus, where we are the groups that are disproportionately affected by those diseases. If we are not represented in the studies, researchers have no way of knowing if the drugs tested will be safe and effective for us. I have found that the people conducting the trials genuinely care and make it as easy as they can for you to participate. Initially, they explain everything to you and emphasize that you can withdraw from the study at any time. They go over all the potential side effects with you. You weigh all the risks and benefits for you in the informed consent process. I find that the trial coordinators try to accommodate my schedule and my needs as much as possible. I go every other Monday for infusion treatment. They make me comfortable with blankets and pillows and darken the room if I want to nod out, and I do go to sleep. I can have people sit with me during the treatment. I'm there for approximately 4 hours or so they give me lunch as well if I'm hungry. There are a lot of concerns that I hear from people when talking about clinical trials. The 2 biggest concerns I hear from other people with lupus are worries about side effects and time commitment. People say, well, I don't want to be somebody's guinea pig. They're scared about side effects. I tell them that with every medication, there's a chance of side effects, but the benefits far outweigh the risk. In the informed consent process, the potential side effects are discussed. You do a risk-benefit analysis for yourself. Can I put up with this side effect to get this benefit? I also trust my healthcare professionals. You have to have a wonderful relationship with your doctor. You have to. It's important. If you don't trust the person that's treating you, you're not going to trust what they're trying to treat you with. Yes, they need to complete their study, but all the people I've come across are doing this research because they care about helping patients, and I trust that they would not do anything that could be harmful to my health. There is a time commitment, but you have to make a commitment to improve your health, period. You might be worried about taking time away from work or your children, but you have to make your health a priority, or you won't be able to keep a job or raise a family. So in parting, I want to say I think it's so important to take back the power over the disease. You have to have something to hold on to. You will feel good that you're helping yourself and other people in the long run. And if you can do that, help yourself and other people, I say why not? Thank you.